Hello, everyone. I am Amanda Olson from Intimate Rose, and I am here joined by my amazing colleagues. We are all physical therapists. We are all doctors of physical therapy. I'm joined by Dr. Dwight Barnes and Dr. Danelle Dickson and Dr. Juan Michelle Martin. And we are here today to discuss racial inequality in life and across healthcare. And so we're just going to be going through a lot of topics that have come to light recently, but certainly these topics are a long time coming. So one of the big questions I think that we can start by outlining is, talk to me about what microaggression is and how do Black healthcare professionals experience this in the workplace? And then I'd also like to hear, like, all of us have been patients in our life. So I think it's beneficial that we all hear what it's like on the healthcare level as a provider. And then what's it like when we're the person on the table?
Hey, sure. Hi, everyone. Dr. Danelle Dickson. Thank you, Amanda, for having us. This is such an amazing forum, so thank you for having us. So to answer your question, when we talk about microaggressions, it's really, it's one of those intangible things. It could be something that's factual or unfactual. It could be a comment. It could be a question. It could be a question posed that would not have normally posed to be posed to someone that is white, that is constantly posed to African American and Black people. That it's kind of like it's a nuanced irritation, and when that nuanced irritation accumulates over time, it becomes this underlying passive aggressive push that makes us feel uncomfortable in spaces, saying things, voicing opinions, or occupying space. And as we're talking about the medical professional, occupying space in our profession. So for example, it would be something that in isolation does not seem like a big deal. So for example, if I were to say, Amanda, I love the color of your hair looks different today. You'd be like, oh yeah, that's cute, that's fine, that's not an issue. But when someone says someone that looks like myself or any of the other panelists, and they say that every single time they walk into a room, it becomes a thing. Do you know what I mean? So for example, again, it's not, in isolation, it's not a big deal. But the fact of the matter is that African Americans and Black people experience these nuanced irritations over and over and over again that are habitual, that other people do not notice that it's happening, but we do. So it now becomes this invisible hand that kind of pushes us away in certain situations, that kinds of let us know that we're not welcome, we're not wanted, or we're deliberately different. We are not the same as everyone else in the room. And microaggressions are very interesting. I think it changes depending on your background. So for example, myself and Jay, and also Devon's, if I'm not mistaken, we all have Caribbean heritage. So it could be something as nuanced as saying, oh, I hear an accent, where are you from? Well, you must be from Jamaica, and there are other Caribbean islands, just like if someone would say, oh, you sound like a New Yorker, but you're clearly not from New York, it's like not recognizing accents or not paying attention to how names are pronounced, or drawing attention to your facial features, or saying, oh, wow, you sound so articulate, you're so articulate. Because the implication is that if you're articulate, then someone else that looks like you isn't, So it's the accumulation of all of these things. It's environmental, it's personal, it's professional. It's things that's said or things that are, body language that starts adding up, that produces this context that of a reminder that we're not welcome and we don't belong here. So that's my description of microaggression. Would love your guys' thoughts on it.
If I can add, I think one of the problems in our society is that whiteness, or the construct of whiteness, is because race is just a societal construct. We all know, like if we did DNA testing, I mean, you could have somebody that has, they look Black, but they could have parents of two different races. So the whole concept of race is just societal. The problem is that everything has been compared to whiteness, with whiteness being the gold standard. So, when it comes to our hair, if you go do a Google search for appropriate or professional hairstyles, just about everybody that pops up is white, And, you know, we've seen time and time again in professional settings where a Black person with dreads, or a Black person with natural hair, such as mine, or a Black person who decides to cut their hair off, like me, you know, they're kind of like, well, why did you do that? Well, that's not professional. Well, why is it not professional? Because this is my hair in its natural state. You know, just the same way your hair is straight, but nobody's probably ever said, well, Amanda, your hair is not professional. And, you know, so we kind of compare everything to a white standard. Similarly, you know, like Danelle said, well, you speak really well. You speak really well. You know, and what the part that they missed is for a Black person, because the assumption is that we don't speak well. You know, that if we speak somehow or another comparatively to a white person, that it's somehow or another surprising. Well, you speak really well, you're very educated. And so those are a lot of the issues that happen even in the work environment, you know, and it may not be, again, it's not something that's just, oh, you speak well, or, you know, your hair is different. It's the context with which it's put forth, and the context with which it's continued to be put forth time after time in society, and the comparisons, you know, and we're stemming from a long history of issues. I actually happened to be watching a documentary called, it was something about like the Black Zoo, where and everybody talks about slavery, but even after the abolition of slavery, when they had like the World Fair in St. Louis, they had Black people and other indigenous people on parade, and the whole Darwinism theory, again, comparing, you know, white man to like apes, and so the closer you were to the ape in features according to their construct was, you know, the less of a man you were. And so naturally they were like, well, black people look like this, so they're not really, you know, so you kind of move down the hierarchical status of evolution, like you're not really a man, like you're not really human. So it's all these types of things that over time have just continued to just, you know, fester and perseverate in all areas of society, including healthcare, including how patients are treated, including how professional environments are run, and things like that.
Well, I guess there's not much more for me to say. It kind of knocked that one out of the park. I think the only thing I would add is that I've noticed typically microaggressions, especially in a workplace environment, tend to be, they're definitely not, the reason they are microaggression and not like active aggression is typically they're said almost in a complimentary way or in a positive tone, but they don't realize that there's like a negative connotation behind it. Like they both mentioned, oh, you speak so well, with the connotation meaning, well, I expected you to sound worse, or you don't sound like what I expected to hear because, well, you're Black. You know, and that whole context doesn't come out, but it's there. Also, I think there's this idea of what Black is, like, you know, like if you're not meeting my preconceived notions of what Black is, then you're somehow different or you're not normal. And they'll even say, you know, there've been times where people say that almost in a complimentary way, oh, but you're different, you know, it's I don't mean you're different. And it's like, well, what do you mean I'm different? Like, you know, like I'm just as Black as whoever you were talking about. So just piggybacking on what was already said, typically the reason that it's a microaggression is it's not something that's said to be offensive. It's not purposely said to be hurtful, but when you think about it in context, it's like, wow, that was not the best thing that I could be saying to somebody.
I'm hearing almost like condescension. And it's like,
Basically.
I have this idea about this group of people and you don't fit it. So,
yep.
So now I'm condescending and, you know, and almost traumatizing in a way that's worse than, I'm not trying to say that it would be worse than hearing like some slanderous, like awful racial slur or something, but because it's like day in, day out.
Yeah.
Like fester was used, like a chronic chronic,
like
ongoing.
that term, bless, you know, when the Southerners say "bless your heart," like "bless your heart" is not a nice statement. So for those who are not Southern that hear it, and a lot of people who are not Southern, they go, "Oh, she's so sweet." No, she is not being sweet. Like that means you just have no clue. Like you're daft, you're an idiot. Like bless your heart.
Yeah.
You know, but again, for people who are not aware, like they may just not think anything of it, but it's being used in a way that's, you know, condescending, disrespectful, and so.
Yeah.
Very, very true.
It is true. And another thing that I wanted to add, I saw this video today that was such a great depiction, and it was a video of it was like, you know, like a little cartoon description of what a microaggression is. It described it as a mosquito bite. So if you get bit by a mosquito one time, you're not, you know, no one dies from it. It's annoying and you rub it and you're like, okay, I'm aware of it. It's there. It's fine. But if you get bitten by mosquitoes every single time, every single day, then it becomes a thing that's now a deterrent to your environment. And for Black people and for African Americans, specifically in healthcare, we already have the burden of being healthcare providers. We already have to show up with the knowledge, the understanding, and the expertise required to do our jobs. But what white people don't understand is that we have to get through the race door first. That's always door number one for us. And then after that, we have to get through the provider door, and that provider door looks very different and presents itself very differently because we are Black. So for example, my favorite microaggression, if I can say favorite microaggression, is, well, you're the therapist. Stuff like that, you know? And I mean, I am pretty sarcastic. So I'd be like, no, I am the cleaner. I've been on your shoulder for like 5 weeks and I'm the cleaner. 5 weeks into treatment. And someone's like, oh, you're the therapist. No, I'm the cleaner. You know, how do you not know who's working on you? You know what I mean? So I love using humor to kind of make people think a little bit. Or, you know, oh, you must be you're the good Black, you know, and for those guys, because, and I'll explain it a little bit, because for me, even in that context, I had no idea what that meant. I'm originally from Trinidad, and in the United States, there is a stratification of immigrant Blacks versus African Americans. So when that statement was said to me by a patient, might I add, and she was very excited about it. Like she was like, no, you're like the good Blacks. And she's like, there was a New York Times article about you guys. Yes, this is great. She sent it to me and everything. And it took me a while to connect the dots, because in my mind, I'm like, if I'm the good Black, who's the bad Black? I don't understand, you know? But it's the concept that, you know, good people or good Blacks, or if you're good, you have certain characteristics that are white that Black people inherently do not have. Do you know what I mean? So I'm well-spoken, I'm articulate, I'm smart, my friends are well-traveled, I get on airplanes, oh my Lord, like imagine that. You know, like all of these inferences of what Blackness looks like is now all of a sudden you're the exception and you become this thing. So when you translate all of these concepts into healthcare, and the fact that specifically in our profession, we are in a profession where we have to make a lot of emotional space for people. You know, like we have to be there. We have to kind of leave ourselves at the door, and we have to permit that emotional and mental space for our patients to occupy, so that they can feel comfortable with the treatment plan, because we are in their faces. We are in their, you know, for you guys that are pelvic floor PTs, you're in their space, you know, and it really helps with the therapeutic alliance of getting that person to trust you and understand your treatment plan and the buy-in necessary to get them through their plan of care and get them to the end. African American and Black therapists have to enter 2 doors instead of 1. We have the race door first. We have to get over that first. And then, even though we enter through the healthcare door, the healthcare provider door, we're still questioned and be like, well, where did you go to school? How long is the program? You know, things that would have never been asked of a white therapist. So is this like an undergraduate degree? You know, like it's the subtle things, you know, that you would not have asked a white therapist. So if a white doctor entered the room, you would not have said, well, how long were you in school for? You know what I mean? Like these things don't happen, and there's such a marked difference. And for us, and you know, you guys tell me, it's something that I just roll with at this point. But ever so often, it becomes that mosquito bite that's just one too many, and it becomes like that. So for people that are constantly exposed to that, you can see how it becomes a deterrent to participation. It becomes a deterrent to saying, I don't want to work in a white hospital. I don't want to work with white patients. Do you know what I mean? I want to work with
I don't want to do home health in a white area because you just never know.
Exactly. You know what I mean? Like it starts trickling down into how we show up at work, because we don't have to want to enter the race door every single time. Do you know,
Right.
you see what I mean? So just wanted to add that.
I hear almost a reference to like, you were who you were. And instead of being appreciated for who you were appreciated for assimilating and being like what they refer, like you weren't who you are. You've been trained to be like this standard, this white standard. And I can see where that would be like one of the ultimate insults, instead of like just giving credit for you know, working hard, going to school and being in front of me, you know, and taking care of me as a patient. And then they go ahead and like email you as to like what qualifies you as being the good person that you are.
It took me years to figure that out. I was like, I don't know what's going on here. It really was a revelation. But to address something that you said, I don't see, and this is the concepts of Blackness that I think are so inaccurate, that I think the U.S. in general really has to undo. It's not about education for Black people is not assimilation. We are educated as a monolith. We are very educated, smart people. And even though the US's history has evolved to edit that concept or to change that perception, the fact of the matter is Black and African American and the African diaspora worldwide are very educated, smart people. We shouldn't have to use, in my mind, words like, well, we assimilated to be educated like, because it now infers that we were never educated before. And we ascended to something that was not the norm. Do you know what I mean?
Yes, and that's what I was trying to say, is that like you were who you are, but instead of giving you credit for that, they were giving you credit for this like negative or pejorative term of assimilation. Instead of you did this educational track. So I'm sorry if I wasn't clear, but like I meant to just say like that you were being you, and that instead of that, they were like putting you into this assimilation track of like, good for you for jumping on our bandwagon. Like, yeah, sorry, that's what I was meaning by it. And yes, I agree that is like incredibly negative and insulting.
Yeah.
And I mean, that's historical though, because when we look at it, again, back to the whole concept, like Dee said, of Blackness and whiteness, you know, the history in this country, again, I grew up outside the country. I know my history. I understand the history of the African diaspora because it was ingrained in us. You know, we know about the uprising and the rebellions when slaves were brought to our shores and they rebelled. And we had to know it in every single island. It was mandated, like this is your history, these are your people, you know, from the Caribbean islands to Brazil, to the US, to wherever else we were. But then we look at history here, and to use a term, the whole history in America has been whitewashed. You know, so everything again goes back to this standard of comparing, you know, well, you know, white people built this, but did we forget, you know, history and pyramids and, you know, like, did we forget all these things? Well, Black people aren't intelligent, but did we realize the you know, the things that were placed on us? We didn't have rights. So even a lot of the things that were developed and created in this country that people marvel over, you know, were created by Black people, but they couldn't take credit for it because things like getting a patent, you don't have any money, you can't get a patent, like you couldn't get those things, you know, so you had to go to whoever you were working for, or you had to go to somebody else. In most cases, they took the credit because that was the white face, you know, you're the one who did the work. You get no credit. You will never be seen in the history book, but you were the one that did it, but you will never be credited for it. And so even, you know, translate that now to the work environment. where we have educated professionals who have done the work. You know, for PT, we all have a doctoral degree. Many of us do continuing education. Many of us have gone above and beyond fellowships and this and that and the next. And oftentimes are then turned down for positions that they have worked hard for, that they're qualified for, that they're credentialed for, even above and beyond. Like, I mean, we probably would be the true definition of, oh, damn, you're overqualified, because we've gone above and beyond. But we never get those positions because you're Black. And then, you know, you look back and then you realize that the person who's gotten the position is somebody who's less qualified, less experienced, and happens to be white, you know. And then you continue to see things like that over and over again, you know, in the professional community. And it's like, well, damn.
Yeah. And it's interesting too, because even when you are qualified or overqualified and you do get the position, there's always the underlying thought by people like, oh, I wonder if that was like an affirmative action hire, or if they had to meet a quota, and it's like, no, because I can tell just from me being in PT school, we had a large PT class of 60 students. I was the only Black student, like, out of all 60. Now there was a Filipino student, and there was a student from, his heritage was from India, but he was born in America. But I was the Black kid, and 60, which was at that time very large. This was 15 years ago. You know, most classes at that time were like 30 to 45, not 60. And I don't know. No one ever said anything to me, but it wouldn't surprise me if there were a few thoughts of, well, I wonder if there was like a quota to be met or something like that. Whereas I think I was one of the first 5 people that were accepted into that incoming class. I had 3 schools that I applied to. I applied very early. I interviewed like 3 weeks after my application packet went out, and by the first of the year, literally the day after New Year's, I had my acceptance letter in the mail. School didn't start until August. So I had been in the course or in the group forever. I had been accepted. I wasn't waitlisted. There was no anything, but it wouldn't surprise me if there were like thoughts of, I wonder like, how did he get in, or was he smart enough, or not that it bothered me. I don't care. I graduated, I'm here. But, you know, it's just, there's always that with being Black, not just in healthcare, but just in general, you always have to kind of be aware of how everyone else feels. Even though you're not doing anything, your presence can make people uncomfortable, especially in different situations. You just have to be aware of where you are and situationally what's going on, because you can be making someone uncomfortable, and that can lead to other things. Even if you're not doing anything wrong, you just have to always be aware of who's around and what's going on, because you're not necessarily being anything but there, but your presence can put people on edge at times, because they don't necessarily know how to act around you, or they're worried if they're going to say something, or if you respond a certain way, then, oh, wait, this is bad. I need help. It's like, no, you don't. We're just having a discussion. It's okay. Like nothing bad is going to happen here. So
there's helicopter.
Yeah. So there's just always this, like Danelle was saying, like there's these extra doors you have to go through before, and I don't know even if it's like before you're seen as who you are, but there's just different perceptions and different barriers that you have to get by.
And that affects the therapeutic alliance, as we were touching on. Your ability to connect, be seen who you are. And Jay mentioned not wanting to go into a place that could be potentially dangerous. Home health.
There was you guys can fill in the details, but there was a physical therapist, I believe it was like in Texas or something like that, home health PT. They got killed, and there are people that have, you know, remarked that they've been in environments mostly occurring, I've heard of in the South. I don't know of elsewhere, but whereby they have been, you know, in neighborhoods and racial slurs have been shouted and things like that. So, I mean, like we think of what we do as something that helps mankind, that helps people, that, you know, we offer this really great thing, and we do. But, you know, in some capacities, like people are afraid to even do that because it can be a safety issue, you know, like no, most people like, you know, the average white person doesn't think of home health as being a safety issue. They think, oh, home health, that's where I'm going to go. Cause you know what, you get paid more, you know, I can make schedule, and if it's like a shorter, like radius, I'm good. The grocery store in the middle of the day or whatever, you know, like you got all this flexibility. And that's what they're thinking of in terms of, you know, home health. Black person, on the other hand, you know, we're thinking home health, oh, I got to be mindful of what neighborhoods I'm going to be going in. I've got to be mindful of the neighborhoods that we're in. I've got to be mindful of, you know, where I am. I got to be mindful of what time I'm getting there. You know, so if I'm going to a certain place, I might need to go to this neighborhood at like 9 o'clock in the morning. You know, like I will not be caught there, especially like daylight savings time. Sun goes down here at 4 o'clock. There is no way I'm going to be caught dead in this particular neighborhood at this particular time. No, ma'am. You know, so these are the things that we have to think about, and not just because, oh, it's dark outside, it's getting darker early. It's because, you know, this skin doesn't allow me to go certain places at certain times.
Yeah.
And that's brain space. Oh, yeah.
No, go ahead. I was just saying, not without extra precautions, right? And kind of like what I was saying before, you just have to be aware of your surroundings a little bit more. Home health is a perfect example, because whether it's nighttime or the middle of the day, then it could be, well, what are you doing? Like, everybody's at work, so who are you coming to see? It's like, well, I have a patient here. Oh, okay, well, where's this patient live? And it's like, I don't know if I can tell you all of this. There are HIPAA laws. I can't just go around telling stuff. But, you know, basically being accused of like casing a neighborhood because everybody's away at work, even though you're there and the sun's up in the middle of the day. So there's just different things that necessarily don't get experienced by everybody. So, you know, home health it's a great field to go into. Even mobile, I know now there's mobile concierge therapy, and a lot of people are doing that, but it's an extra layer of thought that has to be put in when you're not a white therapist, because you might be seen as somebody that's casing a neighborhood or looking to do something that they shouldn't be doing, even though you can have on scrubs or a lab coat or a stethoscope around your neck, and like, okay, but are you really here for that, you know?
Well, I just want to add to that, and it's interesting that you guys brought that up, because I hadn't thought about it in a one time. So I started my practice about 5 or 6 years ago, and before that I did home health. And I remember when I decided this is not for me, you know. So I went to a patient's home not too far from mine. It was off of a major road. So I came in, I parked, and I looked around, and I'm like, okay, this is interesting. Lots of, you know, shrubbery, lots of grass and trees and stuff like that. Get into the patient's house and thought to myself, and again, tend to be comedic. I'm like, if somebody kills me, they'll never find my body. Like, just the setup of the house and where it was, I felt unsafe going in there. Do you know what I mean? But I, in that situation, had to put my fears and my discomfort of being in that environment aside, because I had to put on my professional hat and make sure that this guy that was post-operative was getting the care that he needed. You know, so a lot of times healthcare professionals are in a rock and a hard place. We have to always have our professional hat on, and we lead with that a lot, because that's the thing that allows people to soften their guard. But we don't get to have on our human hat of, wow, this does not feel right to me, or that person was really rude or disrespectful to me. We always have to lead with it. We have an additional armor that we're always carrying. And sometimes the credentials that we have or the expertise that we have is still not good enough, you know? So interesting times. I'm not doing home health again, guys. I ditched that.
I had a, you were talking about that patient, and and I've had patients when I walk in, even after you introduce yourself in the hospital, you say, hi, my name is, and we don't say doctor in the hospital so as not to confuse, with the physicians, but hi, my name is Juan Michelle, and I'm the physical therapist who's going to evaluate you today and get you started, for your care while you're here. Who are you? I'm the physical therapist. Are you the aide? Are you the tech? But it's one thing in the hospital because, I can just be like, all right, I'm out. But, when you're in their home and you go there and they're like, who are you? Oh, you're here to work on me. And at that point in time, you're already there. Like, you can't just leave them, and it's like, yes, I'm here for your therapy. And you're trying to put on a smile and, it's a little Southern term because I'm in Georgia, and they go, oh, bless your heart, sweetie. Okay. All right. Well, I guess let's just get started. And, yeah, it's not fun. And, the things that you want to say and the things that are swirling through your brain you can't say, you're like, you need to get out of here quick. It's going to be the fastest eval ever.
And the follow-up, are you going to be the one that's coming to treat me all the time, or is there an aide maybe?
You have
So you've been
anybody
doing
else?
this a long time, So how long have you been doing this?
Did you go to school for this?
Did you go to school for this? Oh.
No, they handed me a goniometer and said.
They were like, you look like you like to move. You want to be a PT? Yeah. Sure. Sounds great.
I'm telling you, my standard answer, no, I'm the cleaner. I'm telling you, I'm the cleaner. I just walked in here, see what's going on, So interesting.
I walked in a room one time. Are you there? No, let me go get him. After I'd already introduced myself. And it was a bad day. I was tired. I was ticked. I walked in the room and introduced myself, and they're like, I'm Joanne. I'm the therapist that'll be seeing you today. Who are you? I'm the therapist. Where's the therapist? You're not deaf. You're not hard of hearing. You're just being a butt. And I was like, you know what? Let me go get the therapist for you. That's fine. I'll go get the therapist for you.
Wow.
There comes a point, and I don't think we get brownie points for misery or putting up with BS. And
no, we don't, but we do, but it is noted. It's one more thing. So that same patient, I remember him very clearly. He was actually a retired physician. That's the funny part.
Oh, Lord.
And so when he asked me that, like, Jay, I was in a bad mood. I was tired. And I just like, no, I'm the cleaner. I'm like, how do you not know who I am? I've seen you 5 times, sir. And I mean, I didn't say it like angrily. I said it just like I did. I'm just like, how do you not know this? Okay. And he mentioned something to my boss. And it was an issue. It wasn't a reprimand. It wasn't formally put that way, but it was a comment that was made. It's like, oh, so yeah, that patient mentioned that, like you had said something about your cleaner. So even when you're put in positions where you are able to respond as a human, it's an issue. And I think that leads us into the conversation of how microaggressions appear itself on the administrative side in terms of our staff. Like who we are sharing space with, our work colleagues, and how it's integrated into the administrative system, into the healthcare system that does not even support us as professionals. Because now it's a dig against you that a patient had to say something, even though the patient isn't. You know what I mean?
They were at fault and out of line.
Yeah, so.
And along those lines, let's talk about referrals and how you go about securing that alliance with your referral sources and what that looks like.
Jay, you want to take this?
I own my own practice, so I go to the people that I want to. There's a blessing in being a practice owner. I can go to the people that I align with, that align with me. Because when I go to referral sources, I'm not going to get their patients. That's not what I'm going there for. I'm going to develop a relationship with them. I'm going to be, I don't only talk to my referral sources that I'm close to. I don't only talk to them when I need patients, These are people that I'll email every couple weeks. You good? And I have their email addresses. I have their phone numbers. Hey, how you doing? I just want to check in on you today. You know, those are the types of relationships I have with those people. So those are people that I already align with. Those are the people that if something is wrong with my patient, you need to go see this person. I'm just going to call them and make your appointment.
Mm-hmm.
So those are the types of referral sources that I have. And so I don't, you know, in that regard, I don't worry about other referral sources, because I went to an office when I first started my practice, and I went to the front desk and I was like, hi, good afternoon. And, you know, I just said good afternoon because, you know, obviously I walked into a place, it's the polite thing to do. And even when the people in front of me had moved, the front office staff they were all white. There were 3 ladies. The 2 people ahead of me, patients, were white. And there was a white person in the waiting room. So I walk up to this, I'm like, good afternoon. I'm just waiting because I'm like, they've got stuff to do. One lady looked up at me and just looked right back down and continued doing what she was doing. And I'm like, hi, I would like to, I'm doing something, give me a second. Like, just very dismissive. So I turned around and walked out, and then somebody else came in, can I help you? I said, no. I said, I was coming here as a referral partner, but based on the behavior that your staff has exhibited, I really want nothing to do with y'all. And I walked out. So, because if you can't acknowledge me when I walk in there, you know, that tells me you're going to do the same thing to a patient. You're going to do it to anybody that looks like me. And you didn't do it to the people that walked in before me. So.
Yeah. Yeah, that's an interesting question, because you have 3 entrepreneurs kind of here, so I think it kind of changes the dynamic of the answer. I do contract work sometimes for a therapist that has a traditional brick and mortar outpatient clinic, very high volume, and I know he kind of has that traditional therapist doctor relationship where it's kind of like at the end of the year, let me make sure to send out all these really nice gifts so they keep sending me patients type thing. I don't know exactly what his relationship with the doctors is. I've never seen it because, you know, like I said, I contract myself, so I'm not there all the time. But like Jay said, I don't have to deal with things that I don't want to deal with. You know, the doctors that I do know, I feel like it's a mutual benefit that we both have in our relationship. They send patients to me or refer me to different patients. I refer patients to them. There are plenty of times, and any therapist knows this, there are plenty of times that we get patients that aren't happy with their doctor. You know, and they're like, oh, do you know another doctor that does XYZ, whether it be orthopedist or family medicine, anything. And yeah, I do. There's this really great doctor that I know. All his patients love him. I have a good relationship. So I've always felt like I'm just as much a referral source to them as they can be to me. And in that regard, I think it changes the dynamic and the relationship a lot. So I don't really have a negative, you know, not in my business personally, but, you know, I can't speak to that overall in therapy. Obviously in the therapy world, I know it's very different at large. But I think amongst the 3 of us, it's probably going to be a pretty uniform type answer.
Agreed. So to add to that, when I did, before I started my practice, I always led with my credentials. And when I did marketing, I always waived my results as proof that this is why you should come here. I remember this clearly because prior to my last job, I ran a clinic for a while. So I was the person in charge of the marketing. And I felt like I needed to give physicians something to try me, to have a reason to try me, to take a chance on me. You know what I mean? The clinic was owned by an African-American guy. I'm a Black, you know, clinic director. And I felt, and this is downtown DC. you know, most of the physician referrals are white. And I felt that I had to give them something. And the way that before I even had that conversation, I had to be nice with the front desk staff. Those are my people. So my strategy was, you know, I went to Costco and put together these little baskets for them. And I'd be like, I know you guys are stuck here at the phones all day, every day. Here's something, you got little snacks, you have little teas and coffees and instant coffees and stuff. And by making nice with them, that's when I even got a chance to even have an audience with the physicians. And in general, I think you have to earn physicians' attention, but that's how I did it. You know, I always felt like I had to leave with my credentials. Now that I'm a practice owner like Jay, if I don't have to deal with you, I don't have to deal with you. The good thing about being an entrepreneur and owning your own practice is that people buy you. They know who you are, and you don't. There was for me a huge sigh of relief that I can finally be myself. You know, I didn't have to put on two different hats in order to show up at work. You know, I can just be myself. 90% of my referrals are self-referred patients, and maybe on a good day, 10% come from physicians that I've formed relationships across the years. And I deliberately did not want to be a physician referral practice, because I understood from being in that part of the outpatient world how many hoops you have to jump through to keep proving to them that you're good enough. And I was done with that. I just like, listen, I've been doing this for 15 years? I'm good. I'm done. Like, I'm done proving myself. I'm good constantly having to, and this is the burden that people of color always have. As Jay said, white is the gold standard. So if you don't show up as equal or better as, it's a problem. Do you know what I mean? There's no room for error. And that is mentally fatiguing. I wanted to be able to go to the clinic and say, hey guys, I'm going to be treating you today, but next week I'm going home and I'm going to be with my family and I'm going to go home for carnival, and it not be a thing because, oh my God, how can you be away from the clinic and be away from your patients? And it's so terrible. But other people, like the clinic directors, taking 3 weeks off and you got to see all of their patients. Do you know what I mean? I was tired of that, so it was a really big relief for me personally to just be able to show up as yourself, whatever that looks like, and for it to be enough. Like, that was very big for me. So yeah.
Just to be enough.
Mm-hmm.
Amazing.
Stressful.
Only imagine.
Mm-hmm.
I see a really interesting question about how prevalent are the misconceptions of race that are still taught in professional schools like PT, med school.
Ooh. I just had this conversation. I'm in a Facebook group, and it's a multidisciplinary Facebook group. And there was a brand new intern doctor, just graduated med school, going into the hospital. And she shared that in their dermatology class, they learned that Black people have thicker layers of skin than their non-Black counterparts. And I'm like, this is in med school in 2020? Like, this is, and she was asking, like, this can't be right? It's asking different people in the group, and mostly there's a lot of physicians in the group, and they're like, no, that's not correct at all. And I've done wound care in the past, and I'm like, I have not seen any fewer grade 3 or grade 4 wounds in Black people than I have in anyone else. Like, there's no extra barrier or extra skin that has to be broken before the wound. Like, no, it was mind blowing to me that literally in the 21st century, and what should be the upper echelon of education, when you're talking med school, like, you're not a slouch getting into med school, right? And it just blew my mind that was even a thought. And then thinking about pain and pain management, even, like, there's just these long held beliefs that Black people don't have this, they don't feel pain the same way. Even the opioid epidemic, like you'll very rarely see any Black people that are opiate addicts because they're not getting prescribed to them in the first place, because the management of pain is very different. So, and there could be preconceived notions that maybe minorities are more drug seeking, so they're a little more hesitant to give opioids. That could be part of it as well. But again, like the end result is the same. You just do not see those medications prescribed to minority patients. So there's a lot of preconceived notions that you would think would transcend past it, when you're talking the level of education you need to be in healthcare, that wouldn't be an issue, but it's still there. It's very much still a thing.
I'm suppressing a lot of like smart ass responses right now to this general notion.
Go ahead.
Namely that, it was proven in the early 2000s that all people share 99.9% of genetics. So the smart ass in me wants to be like, okay, so, we're sitting here and obviously that sounds like so absurd beyond like the racism behind it. I mentioned like humor is my thing, and I don't mean it to be like that I find any of this silly, but it is so absurd that for me, my coping mechanism is humor, because it is obviously so absurd. But it was proven in the 2000s that humans share 99.9% of common genetics. So my wondering then, if we have current new medical professionals that are supposed to be reading evidence-based texts that have passed multiple peer reviews just to get like published, what is the gap? Like what is happening? And like then the smart aleck responses. So then the 0.1 difference is like the dermal layers of thickness of the skin, and then also going into the very complex pain neuroscience that would be confined to just that 0.1.
It makes no sense. But when you start, I mean, you can start from any point, from pain acknowledgement, treatment of medications, access to care, getting lesser care, getting suboptimal care. You start looking at any of these metrics and start to understand the why, and there's no strong intellectual conversation that you can have to explain a good rationale for why. It all comes back down to racism. And I've said this, so many times, even to the guys on this panel, there's a cognitive dissonance that people have when it comes to Black people and people of color. And it's almost like we're there, but we're not there. We're invisible, like African Americans as clinicians and also as patients, for the most part, we're space occupying lesions. Like people see through us. We're there, but we're not quite there. There's not a lot of thought that's put into treatment patterns, because there are years and maybe decades and centuries of assumptions that's already done that work for most clinicians. So that they already, he's in pain, he just wants opioids. Okay, we're not gonna give him any opioids. Or she's in childbirth and she's calling, or she's just being dramatic. Like, we already have the answer. There's no true clinical expertise applied to when patients show up in front of you. And that when you start looking at the data, you start pulling out all of the numbers, why African American women are dying in childbirth. Jay can talk a lot more to that. Why are the outcomes are the way that they are? It comes down to the fact that clinicians and medicine in general already has a bucket for African Americans and people of color. Even though, as you said, peer-reviewed studies have been shown XYZ, that's not applied in practice, and it comes back down to racism. So unfortunate, but
medical gaslighting.
Yeah. I love that term.
Yeah, let's talk about gaslighting. Jay,
Well, I mean, like when we talk about our patients, for example, chronic pelvic pain, how many times have you heard a patient that they're in pain, they can't have sex, they hurt, and they've gone to the doctor, and the doctor's like, there's nothing wrong with you. Or the patient's like, well, the doctor did a CT scan and they said they didn't see anything. Well, of course they're not going to see anything. What were they expecting to see? You know, when you've got like a vulvodynia patient or something like that. And so now the doctor's like, well, your scan was fine. There's nothing wrong with you. Or I had a patient in the hospital where a nurse she called me, you need to come get this patient up. I said, am I getting the patient up because the patient needs therapy? This is when I worked on labor and delivery. Or is it because you were being lazy? Because I had about had it with some of the nurses. And she was like, well, she's just whining and she's complaining of pain and there's nothing wrong with her. I said, can you give me a little bit of background? Because I'm not just coming up there because you are having an emotional fit. I've got other people that I need to see as well. Well, she had a C-section. Well, give her some grace. I said, well, where's her pain? And she's like, well, she keeps complaining and saying she can't move. I said, I need a pelvic CT scan. And I said, you need to put in a stat order. And the nurse got the order back. I said, and when you get it, call me. I'm not going to the computer and trying to sift through stuff. When you get it, you call me, you let me know. Give me the results and I can, stop what I'm doing and come up there. And when she did, she's like, well, I don't see anything wrong. There's no fracture. And something just kept telling me, Jay, go look at the chart. The lady had a 16 millimeter pubic symphysis separation. 16, you see that cringe you made? Like, I told the lady, I said, she's like, well, I don't understand why she's complaining of so much pain, and the lady happens to be Hispanic. She was Puerto Rican. And so the family is mixed. So you got like some Black family in the room, because like we're like a colorful rainbow of shades of Black. And so, you go in the room and like, she's, more what people would consider typical Latina. And, like her brother is darker and, like her dad is like my complexion and her mom, so we've got like a nice shade of people in there. And I was like, well, what is going on? Well, she's just being whiny. I said, has anybody ever not liked you? What if somebody that didn't like you kicked you in your crotch with a steel toe boot? And she cringed. That same face you just made, that was the face she gave me. I said, well, that's how she feels. Because her pelvis isn't stable. And the fact that you work on this floor and don't understand what that CT scan meant is really shameful. You should not be taking care of anybody. Like nobody at all. She completely disregarded this woman's concerns and feelings. The lady had just had a cesarean. She was not even 24 hours post-delivery. She could not move. She was crying, she was in pain, and she was being dismissed by the very people who were supposed to help her. And it's the same thing when we've got people with pelvic pain and the doctors are telling them crap about go drink a glass of wine, there's nothing wrong with you. That's what happens to us in the Black community. Like we get, race isn't real. Oh, that can't be true. Oh, you must just be imagining things. Like these are the things that we're told when it comes to race issues, in America and in healthcare and what is supposed to be and what is touted as the best healthcare system in the world. So then we get to situations like Black mothers in the hospital giving birth and complaining of pain, but because our skins are thick and we don't feel pain, or so these physicians think, or because nurses are just annoyed because this is just another Black woman, then we think, oh, well, we're not going to give them anything. There's nothing wrong with them. They're just whining. And then we've got women with serious issues. We got women that might be having eclampsia and maybe having blood clot issues and all sorts of things like that, but they're not being checked. And preventable issues, because for the most part, having a baby is not like some major thing. It's not like lifting a rocket up. It's having a baby. People have done it for centuries. And it's worked out really well. People go squat in fields, have a baby. It's been great. Life is good. But we can't do it here in this country that's supposed to have the best birth system. And the maternal mortality rate is 4 to 5 times that of white women. So yeah, it's crazy.
I mean, it almost happened to Serena Williams. Like, if one of the top ranked, most well-known athletes in the world almost dies after childbirth, I mean, that says something. Like, it goes against socioeconomic status. It's across the board, education levels, everything. it's still 4 to 5 times higher in Black women than in non-Black women. You can't explain it away. It literally makes no sense. And the thing I never understood too is, if we're not feeling pain the same way, if we don't experience pain the same, then if someone's complaining of pain, wouldn't that be more emphasis to give them medicine? Like, if we have such high tolerances, if you're in pain, wouldn't that mean it's really bad? Like, the logic just does not make sense.
It doesn't make any sense. It just doesn't.
And
But there's like Dee said, we're put in a bucket, and there's all these preconceived notions about us before we even open our mouths, before we can even say our piece. I was telling someone today, I went into a medical practice. I was asking about and it was a dental office, and I was asking about their self-pay rate. The reason was the insurance that we had at the time was a one of the Christian health share ministries. So we had a $5,000 deductible. So we had to pay everything out of pocket up front. There was no copay. It was just, you pay everything, and once the deductible is met, then they'll cover everything after that. So essentially everything for us was cash pay. So I just went in and I asked them their cash pay rate. Well, we have a payment plan. I said, I didn't ask you about your payment plan. What is your cash pay rate? Well, we don't accept Medicaid. I turned around and I started walking up. Well, where are you going? I said, the sad thing is, you don't even know what you're doing. You can't treat me or my family. Like, you can't. Bye. And I just walked out. So they just assume that we can't do anything. Go ahead.
And something that's I don't remember who said it, but someone made a comment that stuck with me. The same way that police are killing Black men is the same reason why Black women are dying in childbirth in the medical world. And that is because, pain, like reports of pain as medical professionals, is probably our first primary defense against injury and any sort of life debilitating thing. That's one of the biggest signals that we have as humans to detect that something is wrong. And if just on pain control, we can't get that right, that's our first defense. Think of how many people are slipping through the cracks and getting into more chronic situations, more acute situations where they can lose their lives, specifically as Jay said, in terms of, childbirth, that are just being missed. We're not even getting past the first line of defense for African-American and Black women. I am yet to have a child, but I can tell you, I've been following this trend for the past 5 years. And as much as I'm in the medical system, I will be getting a doula because I don't trust that I'm going to get out alive. I don't. And that's a reality for a lot of us, and we have to, it's something that it's going to take undoing at the top levels of medicine and the top levels of administration, because I do think, in addition to the biases that individual practitioners have in treating people of color, and I do think that, being a woman is also a subset of that. That's a whole other conversation. I do think that we have to look at the medical system and how it operates and how it does not allow us the time to adequately screen patients and get the information necessary to give them the right treatment. That's why I decided to get out of the general outpatient ortho game and start getting into private practice where I had the time. That was one of the biggest straws for me. And the fact of the matter is, when you have, as a physician, 2 to 5 minutes to evaluate a patient and you already put your racial biases on top of that, you're going to miss people. It's a fact. You're going to miss people. I'm sure if each of you guys have worked in a situation where you had a very busy schedule, patient every 15, 20 minutes, and you looked back, you could name at least 5 off the top of your head that you missed because you didn't have the time. And we have more time than physicians do. And they are diagnosing and responsible for people's lives. We are doing rehab. Not that our jobs are not important, but it's not, for the most part, it's not life-threatening. They have less time and they have more at stake. And therefore, this system needs to be able to support that endeavor. So I feel really strongly about that. And maybe we'll talk about the whole female thing, male female thing, because that's a whole other subset of why African American women are dying, in childbirth, and they're less treated for pain, they're less acknowledged, they're more likely to go through chronic situations and chronic disease processes. They're less likely to oppose a physician because it's a male, and it's probably a white male at that, and that comes down to cultural differences, but it also plays into the male-female dynamic. There's so many layers to unpeel here to get at the root of the problem.
I've long felt that women are not taken seriously in medicine, and I'm completely hearing to how if you couple that on top of a lens over their face in a short period of time anyways, that compounds that situation.
Mm-hmm. Yeah. And I know a lot, well, both of you guys are pelvic floor physical therapists, but this is something that I often ran to my dance physical therapists and my dance PTs, patients about, that the reason why dancers don't get the medical care that they do is because it's a largely female population. I can't tell you, ask any dancer, male and female, but mostly female. You ask any dancer, what did the doctor say? And they would say, hey, I told him I couldn't do this. And he said, well, just don't do that. Every single person who has been in dance and has an injury could tell you that exact same story. And a lot of it, I think, comes back to the fact that dancers are not taken seriously because it's a female sport, and it's not really a sport, right? You're just twirling around, right? So it comes back to that male-female dynamic. And even though I think dancers are very prone to it, and a lot of my patients I've seen, even those that are not dancers, have received some pretty substandard care at the hands of men because they were female. Like I've chewed out a couple of doctors in DC probably do not like me right now, as I've chewed them out. I'm like, did you even look at the chart? Like the stories and the things, the immediate assumptions that because it's a woman, that, oh, well, she's just overreacting. Oh, well, you must be depressed. Let me put you on antidepressants. I had a patient like that came in for chronic pain. She had a pelvic fracture, ribs fracture, spleen removed, all this stuff, went through rehab, kept cycling back into her pain cycle that manifested as inability to breathe. She spoke like this. She couldn't speak articulately. She had problems, engaging her diaphragm. And even after rehab, 6 months out, when she was not successful and still presenting with all of these symptoms, instead of looking at her chart and doing more diagnostic tests, the doctor immediately said in 5 minutes, you must be depressed. Let me write you some antidepressants. Let me give you some medication. 5 minutes. It's ridiculous. And he wasn't in a hospital setting. This was outpatient. So he had time. So again, you add in constraints of the medical system, all of the things that doctors have to go through. And then you just add in, the race bias, the sex bias, and then, sorry, Dwight, men just being men, or people or humans just being humans. You got this perfect storm of where, people are just going to fall through the medical system every single time.
No offense taken, by the way. I'm married. I hear worse.
Oh, I love it.
This is such a refreshing conversation, guys.
I love it too.
Dwight, what is your experience, if any, with regards to, because I feel like everybody hears the female perspective of like race in this country, and they don't hear black men don't get a chance to do anything or say anything. Mm-hmm. Like, there's the angry black woman and there's a silence to black man, because black men don't even get a chance to be angry because they're just silenced. So what is your take on just Black men in professional settings and in general?
Oh boy, that is a loaded.
I know. I had.
Come on, give it to us.
Oh,
give it
man.
to us. I love it.
Give it to me, Dwight.
Oh man. I mean, from what aspect? From like professional to professional, public perception. Like, you gotta kind of rein me in a little bit.
Yeah.
I don't want to rein you in. No, you need to be unleashed.
Yeah.
Go forth, my friend. Go forth.
Rumble, young man, rumble. Okay. Wow. So, and I may even have a different take on things too, because, like you said, the bless your heart in the South. Like I'm born and raised in the South, being from New Orleans, but then New Orleans is very unique because it's a very, I guess I'd say, a very blue bubble and a very red state. You know, it's a different culture. And I didn't even realize that because it was all I ever knew until I got to college, where you get New Orleans and you get other cities, and then you mix that with all these little blinking you miss it towns and like these very, very small townships that you've never heard of. And they all get there together, and you're 18, literally 18 years old, talking to somebody. It's my spring semester, freshman year, and I'm talking to a classmate, and she's like, "You're the first Black person I've ever spoken with." And I'm like, wow, okay. Wow. You know, so being from the South, and having traveled, grew up on the Gulf Coast, lived on the East Coast, currently living on the West Coast, having seen just how we are perceived in different regions, it's so interesting. But even like in the educational world, I already mentioned I was like the only Black kid in my class. Didn't bother me because I kind of got some exposure to that. I was always in honors classes. I graduated high school a year early. So there was always like a handful of us, but I was never the only person. So that was interesting. And then you start realizing that there's things culturally that we do, like the head nod. You see somebody walking down the street, you just, hey, what's going on? And then I have like classmates next to me, and they're like, do you know him? And it's like, no. it's just I don't know. We see each other and we nod. It's just a thing. I don't know. We got pulled aside one day and they taught us. I don't know how it happened. We know. So there's things like that where you know, in school I always felt like I was kind of teaching people like what's going on, like there's a different perspective or things you think you're being complimentary, like we've talked about at the very beginning, but you're saying things that are kind of insulting. You know, you don't act Black, or you're not the same as everybody else. And it's like, and there's even another side of that too, is because I'm a fairer skinned Black guy and I have light hazel eyes, so people always assume, oh, you have a white parent. It's like, no, I don't. Oh, well then you maybe one of your grandparents. And it's like, no, I like, they're trying to like other me, like, oh, you're not Black, you're something else. And it's like, no, I'm Black. This is Black. I'm a Black person, and I'm not, and then, you know, some kind of weird amalgamation of something else that makes you feel more comfortable because I'm just blowing through your stereotypes of what you thought Black was. And at first I was like proud, like, oh, I'm gonna help people see that Black people aren't just like this thing that they see on the news, like we're people. And then over time, and maybe I just got cynical, I don't know, you start to realize you're not changing the rule in their mind, you're just the exception to it. And it becomes this kind of disheartening, like, okay, you know, and that's across the board. That's personally, that's professionally. You see it with coworkers and colleagues sometimes. You see it with patients. And there is that idea, or, you know, like when Dee was talking about having to keep that professional hat on, because you can't just say, okay, that was crazy. Like, seriously, why, what are you thinking? Like, why would you say something like, you know, that's just nuts. As a new grad, right after Obama was elected, I had started working clinical rotation. I got hired on as a new grad. My clinic was slow, so they actually sent me, I was with Select PT back in the day. They sent me to another office that was nearby. So I went and I'm working on this lady, and you know, the inauguration was on all over TV, historical event. So I mean, the mall is crowded, and they're showing them, and I'm working on this lady. She's a brand new rotator cuff repair, right? And I'm working, I'm doing my moves. I'm like new grad, so I'm like, oh, I gotta be really good and, you know, take care. And she's like, I am so sick of this being on the news. Like, it's all over everywhere. And I'm like, okay, whatever. Like, you know, her soap opera's not on today, whatever. Literally, as I'm holding her post-op shoulder in my hand, she says, I hope you're happy you got one of yours in the White House.
Oh. She's brave.
Like,
this is a moment when you go WTF, plus I want to drop your hand, plus nope, wait, give me your hand back because I want to twist it in ways it shouldn't go.
all of that, all in like in the span of like 2 minutes. And like, I am so well versed in sarcasm. I am a smart ass to the fifth power. And all of that, I'm fighting it in my head because I'm like, you're wearing a Select PT polo right now.
Mm.
And I was just like, just like, do you know, like, if I sneezed right now, you would be in pain for the rest of this week. I could just that easy. And I was just like, okay, let me finish this, and I'm just gonna put it down. Like, there's nothing to be said right now. Because clearly, if you're gonna say something like that to the person holding you and taking care of you in this moment when you're the most vulnerable, there's clearly no dialogue to be had right now. So let me just go ahead and finish this up, and I'm good. I'm gonna go this way. And you know, it's just that constant awareness. And then to the extra fact, as a guy, I know that I have to be really careful, because if I do react or respond, then I'm seen as aggressive. And if I'm seen as aggressive, then that could be a 911 call, and then it's a whole other thing. So there's a lot of layers to stuff. It's like navigating through society, whether it be just like run into a store, and like even growing up, run into the store, like going to look for something, and there's not something like the thing. Say my mom sent me to the store for something, and the thing I need isn't there, or it's not the right brand, because my mom's very particular. I still know I should probably pick something up anyway, because I don't want them to think I just ran to the back of the store and pick something up and now I'm stealing it and I'm running out. So I will stop and get like a pack of gum or a Coke or something, because why were you in and out really fast for no reason? You know, it's just stuff like that. Even growing up, there's always this thought, and there's always this awareness of, even if I'm not doing something wrong, I have to be aware of what things look like. And, you know, it's still the same. It's professionally, it's the same. Socially, it's the same. It's just that way. The guy in Central Park, like, perfect example. He was just bird watching, and he told the lady to put her dog on its leash, and she's like, I'm going to call the cops and tell them that you're threatening me. And it's like, luckily he was recording the whole thing, but it's that thing, like, if you're viewed as aggressive and there's a police call that's made, there's automatically like an association with guilt. Like, you're not innocent until proven guilty in that effect. You're guilty until proven innocent, and you might be, before we prove your innocence, you might not be here anymore. So there's always like this thought of, all right, I have to make sure I don't react to anything. I have to watch how people are responding. Like, I got to read the room. I got to know what's going on. There's always this hyper awareness and hyper vigilance of the situation and surroundings, because if things pop off, whether or not I was involved with anything at all, I might be viewed as a suspect here. So
how does that affect your therapeutic alliance with your patients? Like, how do you navigate that stuff? Like with that lady with the Obama comments, I'm pretty sure, you know, you were like, we can part ways here, but.
Yeah, so luckily that happened at a clinic that wasn't my clinic. It was a nearby clinic, um, but it wasn't mine. And I knew I wasn't going to see her anymore. I wasn't taking care of her anymore. I was just covering for somebody. So it was, I mean, it was egregiously bad, but it was easy for me to be like, you know what? Not my problem. And I could walk away. Now, had that been someone in my clinic, I don't know, that would definitely have to have had to be a conversation that I would have to have with my boss at the time, who was the supervising therapist, and we'd have to. And luckily, ironically, her name was Karen.
I don't know who's naming their child Karen.
I don't think nobody's naming their child Karen for a long time.
Ironically, her name was Karen, but she was a great boss. She was really cool, and I knew she would have had my back, especially if something like that would have happened. She probably would have got rid of the lady altogether. But again, it wasn't my clinic, so I didn't really have to navigate that road, luckily. And I haven't really had anything that egregious happen. I was a traveler for a while, and I would hear things sometimes, or things would get back to me, but it was never that blatant and that direct. So I've never really, really dealt with it head on that way. But yeah, it does have an effect. It's just you have to be really aware of the room. You have to be aware of who you're treating and responses. I take that back. I did have one in Arizona. It was an older guy. He had a catastrophic stroke. He was completely hemiplegic. His family's in the room. Much, much older gentleman, to put things into perspective. And I'm like trying to check him out. I'm doing an eval. I need to check his strength. He can barely sit in a chair. I'm trying to hold him up. And he literally, with his one good side, swung at me. And his family's like, he's just in a bad mood today. And I'm like, that's a little bit beyond bad mood, but okay. Again, he's a very old guy. He just had a stroke. I mean, what am I going to do? Like, swing back? I just have to be like, let me go ahead and finish up, and I got to get out. Because again, if any perception of me being upset or angry or saying something could be, like Dee said earlier, then I am, even though I'm not wrong, it becomes a thing where I have to defend myself because a family member said something to an administrator, and it's like a thing. So yeah, you always have to be aware of who you're with, what's going on, and just kind of know the room. And if you can diffuse, like I said, I'm a smart ass. I diffuse with humor a lot, but some things you just can't diffuse. So it's like, I just need to remove myself from this situation because I don't know where things are going to go. And if I can't predict where things are going to go, then I just need to get out.
Does it feel like a third door? Like being a man, where like it sounds like you're suppressing normal human emotions because of unpredictability of how it may escalate and like how it may be perceived.
In a way, it definitely can be. And luckily it doesn't happen often. It really doesn't. And it's so much easier now, not being employed in some kind of corporate organization helps a lot because it limits who I'm going to be in front of anyway, and I have a lot more say. It's my company. I can do what I want. But it's still, yeah, it takes a lot. You have to just I just keep coming back to saying it. You just have to really be aware of everything that's going on. You have to be aware of, if I do a concierge visit, I do a lot of telehealth, which is great because I don't have to be anywhere. But sometimes for local patients, I'll do like a concierge appointment where I'll just go to them if they're close by. And yeah, you know, we talked about that earlier with home health. Like, if I don't necessarily know the neighborhood, it's like, okay, well, let me make sure to be there at like noon when, you know, maybe there's going to be a UPS driver or an Amazon guy there, or like just other people where there's normal business happening. So it's not like some weird, suspicious, why are you here? And when everybody's at work, and things that normal therapists probably aren't, or I don't want to say normal because it makes it sound like being black's not normal. Things that non-black therapists probably would never even think of, like that wouldn't enter their mind. You have to just be extra vigilant and aware of situations and where you're going and what times of day, and it's just extra things that you have to be concerned with.
Do you guys collect, like, and you could eat, we're coming at this from different corners of the United States. Do you think there's an East Coast and a West Coast difference, or does it feel the same?
By degrees, yes, but overall, no. And the reason I say that is there's a certain level of racial tension wherever you go, just period. It's just how blatant is it? And to a certain degree, believe it or not, I actually like the South where it's more blatant because I know where I stand. You know, there's no surprises. It's like, boom, there it is. And you're like, okay, cool, I'm going to go. Whereas when you almost like Get Out, like the movie, you know, like, oh, if Obama could have run a third time, I would have voted for him again. Like, there's a lot of that. And then it gets a little too late, or you're looking for an address because you're new to this neighborhood and you're trying to find where this patient lives. So you're driving a little too slow, and that's just not what we're used to, or it's a little suspicious. And it's not in your face and overt, but you can still have, like, if it's a gated community, maybe they're holding you a little bit longer than you understand at the little crossbar before they let you in. Or it's just things that happen where you're like, huh, okay. Like, it's not blatant, but you kind of have a really good idea of what's going on, but nobody's really saying anything, and it's just kind of wafting around. So it's just stuff like that. So I'd rather it be more overt and just be more in your face, honestly, because it's just easier to navigate when it's obvious.
And you know kind of what beast you're dealing with.
Yeah.
Well, that's an interesting point. Like Jay, I grew up outside of the United States for about, I would say, 50% of my life. So a lot of the racial awareness that I have now is relatively new. And I'm so used to people not treating you based on the color of your skin. And in Trinidad, just for context, it's way more of a classist society than it is a racist society. So, you know, socioeconomic status counts a lot more for how you're treated. If there is a difference in terms of how people are treated. So I'm so much more used to people being civil and being, you know, like basic necessity of conversation and communication is being civil and pleasant. I'm so used to that when I don't encounter it, it always jars me. So for a long time, I never understood why I hated going to Virginia, besides the fact I would get lost, but that's a whole other story. Like, I just could not, I would always get lost every time I crossed that bridge. It could drive me crazy. But I could never understood, every time I went to Virginia, if I wanted to go shop or do something or visit someone, there was a vibe that Virginia gave me that I did not like, and I couldn't put my hand on it. And it took me years to figure out that there was this open hostility, that people would stare, you know what I mean? And it was just, it was a distinct discomfort that I had never needed to navigate. So for me, you know, I'm okay with the northern, with the northern stuff of like, well, hey, how are you? You know, and they may not purchase something from you, or they may not sit next to you, but at least they're pleasant. That's what I'm more used to. you know, versus the overt, like, why are you here? You know, like, I'm not used to that at all. So but you know, it's a continuum, and I guess the longer that I'm in the US, the more the more sides of racism that I am encountering in terms of how it can manifest itself. So
Interesting.
I went to school in Alabama for undergrad. I have seen overt racism there. I have seen overt racism in the Northeast. Most people don't even think, they're like, oh, it's like the Northeast. No, and I would never forget one of the scariest encounters I had was I had gone out with some friends. We were there for a conference. I couldn't have been more than 19. We'd gone out we were at a conference, and we got done with all the workshops and everything early on that particular day. And we're like, let's go hit up, let's hit up a bar. Let's go hang out for a little bit or whatever. And we were in Rhode Island. We were in Providence. And it was a group of about 5 girls. I was one of 2 Black girls. And then there was a group of guys ahead of us, and there was another group of us behind, and kind of like there were just little groups of us, and we're all walking. We all knew each other, but the group ahead of us, there were like about 5 of them. There were 4 white guys and a Black guy. And this pickup truck of these white guys just drove by, and one of them threw a glass bottle at the Black guy and just started shouting racial slurs. And, and I was like, did that just, when you're frozen and like people are like, come on, like, is that really just, because I was like, but we are in Rhode Island. Because you think the further north you get, the safer you are. Mm-mm. And I learned very, very early that was not the case. And, and it was like, okay, all right, be aware. So it's almost like you always have to have an exit strategy is what, like my husband and I, when we talk, we're like, you always have to have your exit strategy. You get to an area, you scope out your surroundings, whether it be professionally or, personally, and you're going about your everyday life, but always make sure you have your exit strategy, because you don't know who is there. You don't know what their mentality is, and you just need to make sure you can see your way out of things without any issue.
It's so funny you say that. So one of our friends in our business mentoring group mentioned that to me about a year ago. We had just met, and we were, getting familiar. We went on a trip, and she said to me, she's like, Dee, you always sit and then just observe people. I was like, yeah, because I'm always looking for the first reason why, like, okay, do I need to be here? Do I just need to leave? Mm-hmm. And I mean, in that setting, it had a lot more to do with just social anxiety and just not knowing people. But it's so interesting that Jay brought that up, because this is a thing, that now starts bleeding into other parts of your life. If you have racial tensions and you're not sure if this is a bar that you should be at, or this is a patient's house that's going to welcome you, it now starts manifesting itself in social anxiety and, like the way that we speak to people, how friendly we are. Do we smile with everyone? Do we shake everyone's hand? Like, do we buy that juice or that product to go into that supermarket? There is such a insidious trickle down effect of racism into the lives of African American and Black people that you just don't see, so things that we laugh and joke about, like as Dwight said, you see another Black person, you give them the nod. Like it's almost like we have to we are constantly mapping our environment to figure out where we're safe, from an emotional standpoint, from a physical standpoint, from a professional standpoint. How are we safe? Is this a safe thing to do? Because like there's a crazy algorithm in our brain is saying, if we do this is the outcome. No, we can't go there. We got to do this. Like we're constantly going to try and figure out where are we safe in our environment. And it's a lot to deal with. It's a lot to deal with. And I'm pretty sure, if we had to dig into like mental health research, it manifests itself somewhere. And then follow that trend. If we're having all of these things that are going on in our minds, how does that now start affect our health? How does that sort of affect, our immune system? How does it affect our resilience and our ability to fight off diseases? I mean, there's so many trickle-down effects to this. We look at animals in the wild, and when they're under stress, they don't survive well. All of that plays in. We're animals too. We're evolved animals, but we are animals. So when you have an environment that's consistently stressful, or, when we talked about the microaggressions that has, minute hostilities built into the culture that doesn't allow someone to thrive, it then starts really affecting that person's ability to just be, and just to be human. So it's so interesting that she brought that up.
You say that, and it's funny because I think about, here everybody is quick to mention, well, Black people are at higher risk of dying from heart failure, and they're at higher risk of dying from this and that and the next. And then I go, yeah, but all the Black people I know live for a long time. Like I grew up with my great-great-grandparents. One of them died at 89. The other one died at 92. My daughter was raised with all of her great-grandparents alive. Like she was born and all her great-grandparents were alive, or rather, yeah, and a couple of her great-great-grandparents were alive when she was born. My grandfather just passed, just before my son was born, and he was 92. My grandmother was 90. But these are people in their home environment. And while here they're like, well, they got diabetes and they got this and they got that. And I know like food for us is different here, especially depending on where you moved. If you're Black and came from outside the country, and then unless you're like in a specific community of your peers, then, food and different things might be different. But I always thought about the effect of these things, like you just said, on our health, because you got Black folks in other countries and they're living till they're like 90 and 100. And my girlfriend's grandma, one is 98 and the other one's 105. They're both still alive. And they're Haitian. And I've got my friend's father is still in Nigeria and he is like 97, and alive and kicking, doesn't use an assistive device, walks around, just independent with everything. He's 97. Yeah. And I wonder how much of our environment and how much has a lot of these stresses placed on our health in general. Because when you look outside of the US, outside of like the catastrophic situations like war and those types of things, and like, any type of struggles like that going on in certain countries. But outside of that, we're thriving everywhere else. So I'm like, what is going on?
Yeah. And to answer your question, Jay, because I did a bit of research on this, when you look at the health outcomes for African Americans versus immigrant Blacks, like 0 to 5 years, the health outcomes for immigrant Blacks way better. The longer that they are in the US, it starts declining and matching those of African Americans. So it's the environment, you know what I mean? It's the environment that we're exposed to. And I mean, that environment could be, dissected in so many different ways, the food, the weather. But a lot of it is that the environment is not friendly to African Americans thriving. And that's why, I mean, in so many of my different networks, the conversation ebbs and flows, but recently with the death of George Floyd, there's been this new conversation of like, okay, guys, where's a good country to migrate to? Like who's been to Ghana? Who's been to Sierra Leone? Because, the quality of your life, when you realize how it's affected, some people they're not content to wait for a change. They want to live and they want to thrive now, and they're willing to relocate even all the way to Africa in order to do that. It's something that I have personally thought about, like, when am I going home again? And I mean, that's a conversation that I've always had, but when these things start clustering and presenting the way that it is, it becomes a way more valid conversation to have, so.
Wow.
You moved here as an adult, or were you a student still, or were you an adult?
I was a student. I came here when I was 21 for undergrad. Yeah.
Did you have any concept of these societal issues prior to moving? Like, were you warned?
I had no goddamn idea. Like, no idea. When I
tell you, just like,
well, here's the thing, and this is very interesting. I have been and it took me a while to understand and accept this, but I have been in a Caribbean bubble of privilege for about 15 years. I've been in the US 20 years. My awareness of the experience of African Americans and the Black diaspora here, the negative aspects of it, was only forefront in my mind in the past 5 years. And that is because in undergrad, also in grad school, my environment was mostly people that looked and sounded like me. I lived with Caribbean people. I lived with my parents when I was in New York. So even though I, mingled, I don't want to say like I was isolated, but even though I was in environments that was not natural to me, I was able to undo any sort of negative effects because my home environment and my environment that was nurturing was still people that looked and sounded like me. And looking back, when I did feel it and I didn't recognize it then, I just felt like, oh, I'm kind of stressed, like school is a lot. I would just go home because I had an option to. I would go home and I would visit my family and I would reset, go to the beach, eat some doubles, eat some food and come back and I would be good, And unfortunately, African Americans don't have that option. They're here. This is their home. I had an option to leave. So for me, it has definitely been an awakening, a continuum of understanding what the struggle is, because before I was just like, slavery's done, what are we still talking about? Like, I remember being in undergrad and getting in battles with my African American friends. It would be like the crack cocaine versus the powder cocaine. They had this whole battle. They had a whole town hall meeting. And I'm like, just don't do coke. I don't understand what you're talking about. Why is there a choice, not understanding that there was a whole system in the judicial system and in the police force that was designed to target African Americans and give them heavier sentences than whites have been doing the same damn drug. You know what I mean? Like, I didn't see that. I just saw the surface, which is like, why are you doing coke? Like, what's going on? How can I help you here? So it's layers. And I think immigrants that are coming to the US for a better life and looking, to improve their quality of life as they try to fit into society, unless they are subject to those same things, you don't quite see it. And I can look back now to today and I realize that I've been exposed to a lot of racist stuff. I didn't see it as that initially, because my primarily lens in terms of how I grew up is not race. I was just like, well, that's a cranky old man. Well, that lady probably doesn't like me because I probably look weird. Like I had a rationale for everything. It never entered my mind that my race was the first thing that was the issue until maybe 5 years ago when a lot of these police shootings started to happen. And I was just like, wait a minute, what the hell is going on? So that's a little bit of my lens. My lens is a little bit different.
Thank you for telling me. It's one of those things that, like, I'm hearing you say, like, a lot of people are feeling like this is no longer a safe place to be. And I can imagine as a parent, like, not wanting that for your children too. I don't want it for my children. And so how do we make it better? What do we do?
Oh boy.
Oh, Jesus. Where do we start?
I think people have to want to do the work. Like my biggest fear with this right now is that these conversations are happening, but some people are just kind of like, all right, let me just ride this out. Let's just hurry up and be over, and let's just go back, to how everything was. So a lot of people are just kind of sitting back and waiting for things to ride out. And that's one of my biggest fears, because there are a lot of people who are not intent on doing anything. And we're not going to make any changes. Like, we're dealing with issues that my parents' generation didn't deal with, that my grandparents' generation, that they had to deal with in their eras. Granted, my family, like these, was overseas, but people in their generational group would have dealt with here. And we're still dealing with it now. Like, these are things that my kids are seeing, and they're 7 and 5, and it's going to be sad if this is going to have to be their reality too in 2020. Like, it just blows my mind. So I feel like people have to people have to acknowledge that there is a problem. And the problem, one of the biggest issues right now is that there are a lot of whites who are just, you know, they don't want to listen. They're still being so defensive. But I'm not like that. Nobody's saying you're like that. But you cannot attempt to begin to understand someone if you don't shut up long enough to listen. It's like us in healthcare. Like the first thing we do when somebody is coming in and they have a problem, we shut up and listen. We don't do like the doctors and interject in like 5 seconds. We sit there and we listen. We let them tell their story. If there are specific things we need to know, we may ask some more directed questions. And then we look at the information that's given to us and try to strategize a game plan. And that's what we need right now. Like people need to listen. And then we need to take our collective efforts and resources and start to push in a new direction. Because if all of us don't do it, we're going to be in the same bind.
Right. Yeah, I use the clinician analogy a lot. You know, when you're a new grad, you have a preconceived notion of like, oh, this is how I learned it. This is how it's supposed to be. In the book, it said this, this, and this. And then you start working with people and you're like, oh, that was a little bit different. Okay, whatever. You have the rule, and then this person's the exception. And then you get so many exceptions over time, you're like, maybe the book is just general. But like what Jay was saying, if everybody just takes a step back and you just listen, like if this is new information for a lot of people and it's not something that they're used to hearing, be like a clinician, listen, just listen. And then, okay, that was that person. And then I listened to this person. Okay, that was that person. And then after you've listened to so many people, you start to recognize the patterns. And you don't necessarily need to hear every detail and every little bit of information to understand what the end result is, because you've seen this case or these symptoms so many times before that you can get to the conclusion faster. That's the difference between an experienced clinician and a new grad is a new grad they have to have that repetition over and over and over again before they can get to the same conclusion. And I think that's where society is at this moment. It used to be, well, you're just sensitive, you know. I don't think that's what it really was. You're just being overly sensitive. You're playing the race card. You're hearing what you want to hear. But then when video comes out and then another video comes out and it comes out more and more often, then it's like, oh, well, maybe this was a thing that's been going on. And people, you know, Black people have said for years, yes, this has happened for a long time. We just didn't have video cameras in our pockets to document it. So, I mean, you can say things over and over, but when there's a video and you see it, even at first, I mean, it used to drive me crazy, like in the first few years, like Trayvon Martin's and Tamir Rice and things like that. People would see a video and still be like, well, we don't know what happened before. You know, like what led up to deserve it. Yeah, like what led up to that moment. But then when you start seeing it over and over and over, all these different cases, and they all all these parallels, it's like the new grad becoming an experienced clinician. Once you see the same pattern over and over again, you start to see, wait a minute, maybe this isn't, you know, this goes from it's just this patient or it's just these patients to, okay, we have a systemic thing here. Like this isn't just the flu, this is an epidemic. Oh, this isn't an epidemic, this is a pandemic. Like you start small and as you get more and more cases, you start to see how profound it is. And it's not just isolated incidents, it's all over. And I don't know how long it's gonna take for progress to come out of this, but this added awareness, like we're definitely on the cusp of something, and I don't know where it goes from here. I hope it becomes something beneficial to everybody and we move forward. But it's hard to say what the next step should be, other than we can't have a bunch of people that are just continually trying to find ways to deny what they're seeing and to justify going back to, well, I was comfortable with the way things were before. Yeah, you were, but there are a lot of people who weren't, you know. So and there's really no argument for going back. Like honestly, why would we go back if you're now aware that there are many people that were being treated unfairly? Why would you want to just wait for something to die down and go back to the way it was before? Like now you're just actively wanting to just be comfortable over caring over a whole population of people that are going through something.
So my thoughts, I have so many thoughts on it, and I go all the way from the super conservative to the super radical, you know, spectrum of things. Um, I think, you know, to Dwight's point, you know, we've seen a critical mass, you know, a tipping point, a crescendo of all of these things that has happened over time that has now come part of the American consciousness, but also internationally, which I think is huge. That has never happened before for the African diaspora to understand the effect of racism and its sisters, colonialism, colorism, all of that stuff, and how it affects us worldwide as a population. So what I love that is happening is just this, you know, we're now having conversations. This conversation would have never happened 8 years ago. That's a fact. And it's unfortunate that a man's life had to be sacrificed for that. But this in itself is progress, because understanding the process and understanding the hurt and the pain and how it affects other people and wanting to do differently, I think as a society is the first best step that we can ever do, because that societal pressure is now going to put pressure on the guys who do not want to change or that have an actual benefit in seeing people of color or African Americans or Blacks in the position that they are. They're going to put pressure on those guys. And that I think is going to accumulate and really usher in the change that we have. Because it's ironic that the thing that's causing change right now is not a change to a law. It's not the passing of legislation, but it's a social consciousness of people. You know, it's ironic that that's what's pushing this awareness forward. In terms of healthcare, for me, you know, I do believe, again, there are clinicians. I don't believe that clinicians get into medicine because they want to harm people. Like medicine is a heavy master. You know, it's time intensive, it's emotion intensive. It takes so much of our lives and our attention and our time to master, to become decently proficient in. No one enters medicine with bad intentions. I believe that. So what we now need to look at is if someone is truly a good clinician and truly a good person, and I mean, of course, there are outliers, but let's look at that bell curve and we're in the middle. If people are truly good, then what else is affecting their ability to not provide good care and not to do the right thing? What we see as the right thing, but what actually should be policy. And that comes back to how we practice, the systems in which we practice. And it comes down to all of the other factors, including financial, that incentivize people to act the way that they do. So just as we know that there is a reason why, you know, doctors in minority populations perform a certain amount of orthopedic surgeries because they get paid for it. We know this, all right? There's also an incentive, and I don't know where those dollars, where those coins, if we start following the dollars, where that lies. But there are incentives for I believe that there are financial incentives to not treat African Americans the best that we can. So I feel like we need to start peeling apart those layers. Where is the money coming from? Why is there a financial incentive to treat African Americans the way that they do? And when you look at the research, it shows, you know, like whites usually get preferential treatment in terms of the most updated healthcare or the newest procedures. You know, why is that? It's usually because they have the best insurance that's going to pay. There's the financial line. We need to look at that. We need to start peeling those things apart. And we need to make sure that the healthcare system is really equitably accessed for everyone. So I just want to deconstruct the whole thing. And so,
You know, sometimes to fix something, you got to tear it apart and rebuild it.
yep.
It just can't be, you know, sometimes it's just easier to start over. So
Yep.
that's a thought.
And I agree with you on that, on the leave. And I remember when my kids were born, I always said, because of experiences I've had with race in this country, I came from another country. I will happily go back. I can gladly turn in the U.S. passport tomorrow because my other passport is right here and both my kids have dual citizenship. It is not a problem. And that was strategically done so that at any point in time, if I had to go, I can go. My kids were going to be okay because I've seen so many things and I don't want that to be part of their reality. Like, I don't feel like it should have to be. Like, I don't feel like they should have to be dealing with racial slurs and you know, and all these different types of prejudices as they're growing up. And, you know, and I'm like, they're kids, they're children. But you've got these things, you know, escalating to the point. Tamir Rice, Trayvon Martin, that could easily be my son walking down the road with a hoodie on because it's fall and he's cold and he just has on a hoodie, but because someone just for whatever reason assumes, oh, he's got a hoodie on, he's a black kid, he must be up to no good, that now, you know, he doesn't deserve to be here. You know what I mean? And so, like, I just think it's crazy.
It wasn't even fall, it was winter. It was all-star weekend.
Well,
It was
yeah.
February.
To have a hoodie on.
Yeah. So.
And you know, just to kind of reiterate, guys, like we have to look back. You know, like history never fails us. Like never, ever. You know, we look back. Why was slavery abolished in the Caribbean? Because it was financially unattainable for them to continue. They had to find another way to move forward. The slaves kept revolting, they kept killing those people, and France and Britain was like, we're good, we're done. We can't sustain this. This ain't working anymore, be free. You know what I mean? So I do really strongly believe that, you know, like even when we're talking about all of the things that are going on in the political system right now, I am excited about the social change that is happening. Again, this conversation is proof of that. I am excited that, you know, people are now going out and buying out books on, you know, African American history that they didn't know about before, or talking about, you know, the psychology of, you know, whiteness and how do we deconstruct that white frailty, all of that fun stuff. I love that that is happening. I love that there's so many people who are not doing it just for the one square, you know, the black square, Black Lives Matter for one day, and then they go back to business as usual. And they are progressing it and they're really examining their lives and realizing how the concept of whiteness and racism has pervaded their life and how they can start undoing it. Because it's a monumental task. You know, it's a very intricate, very layered system. And it's not something that's going to be undone in a day. And I love to see that people are showing up. You know, they're showing up for work and they're doing their part every day, whether it's, you know, going to protest outside of the White House, or they are having community conversations or professional conversations like this. I love that that is happening because I do believe the social pressure to not be an asshole human, pardon my French, is stronger than ever, you know? And I love that that's happening.
It is true. And I hope, because we've gotten so polarized and so, I mean, we really do. We have a country that lives in it. Whatever bubble you select to be in, you can just be insulated and not hear consent or dissent or, you know, like a differing opinion at all. And I think it's been forced on people. Maybe they didn't want it and it's lingering. It's not, you know, it's not the regular news cycle where it's here for like a day or two and then we're on to the next story and to the next thing. It's been sitting here and it's heavy and it's burdensome, and some people don't want to talk about it, but they're being forced to talk about it, and they're being forced to hear voices that they're not used to hearing and opinions that they're not used to hearing and points of view that they've never heard before. And it's forced this new awareness of things. And I think that's becoming an amazing, that's why this feels like such a different tipping point. It's because there is such a different change of overall opinions of things good and bad, but seemingly more for the good. And it is kind of exciting and a little scary to see what comes of it, but we'll see.
Yeah. And I do think if we didn't have COVID-19, this wouldn't have happened.
That's true
Like,
too.
people needed to be still and at home and on their phones and paying attention, you know? Because if you know, everyone was out and about, it would have been swallowed in the news cycle. I really believe that. So.
Well, if you think about it, it's the first time in forever. When's the last time you've heard celebrity news or celebrity gossip or anything Kardashian? There's no sports, you know, like
Sports aren't on. You can't hide it with baseball.
Yeah, they're not a bunch of summer blockbusters being released every weekend. So it's like there's very few things to divert people's attention. So you're going to hear it. It's going to happen. And yeah, COVID is, I guess, in a weird way, you can kind of look at it as a sort of mixed blessing in that regard, because it's canceled out so many other things that it's forcing people to hear certain, just be on topic.
Yeah.
It's almost like the apocalypse that needed to happen. You know, it's like, kind of like you mentioned, like slavery wasn't abolished in the islands because it was the right thing to do. It was because it was no longer like a financially feasible thing. So it's like we had this like total shutdown of our country that created this moment where we could peel a rotting, festering Band-Aid off of a situation that needed to be handled. It's like, I think we should have this conversation again in a year. I think we should all get together in a year.
A follow-up.
Yeah.
I would definitely love to see that. Hopefully with a good outcome too. Like, hopefully we're having a very different conversation. Like, wow, remember how crappy 2020 was?
I can imagine a scenario where
2021 is going to be so boring. Everybody's
I know.
I'm like,
It'll be like,
how's your 2021 going so far? Yeah, I don't know. Boring is going to be the new thing, man. I'm telling you, people are like waiting for boring.
Yeah, we are.
I've told people before, boring is a privilege. Like, boring means everything's taken care of and you're not worried about anything. Because when you're freaked out of your mind and you're scared, you're not bored.
That is true. That is very true.
So true.
But thank you for having this conversation, Amanda. I have to say that this is this is for, and I'm pretty sure I speak for these guys, but I will speak for myself. You know, it's so refreshing to have the outreach that has been happening, because as you know, Dwight said, you know, like, these things have been going on forever. Even in healthcare, it's been going on forever. You know, now we have social media and we have technology on our side to say, hey, it's here, like, this is something that's happening, and it's prompting us to have conversations like we're having right now. And I really do think that this is a thing that starts ushering in change. Because the one thing that I always thought that was so interesting about American society is this, like there were blocks of things that you can engage people on. You can't talk about religion, you can't talk about politics. Like, it was a rule and I never got it. I'm just like, well, how, but politics like affects every aspect of your life. How could you not? It's like not talking about the weather. It just was odd to me. And this is the first time that people are engaging. They're having conversation. And I've said it a million times, I'll say it again. I do think Americans have lost the concept of civil discourse, and they've lost the concept of like critical thinking, like thinking for yourself, just like Dwight said, you know, or even as you said, you know, like, if we know that, you know, 99% of the human genealogy is the same, how do you account for the 1% that tells you that African Americans have thicker skin? Like, that makes no sense. You know, like, critical thinking is not a thing that happens very often in the US, unfortunately. Neither does civil discourse. And all of a sudden they're on the table and people are learning and really engaging and relearning that skill. And I think it's so important for us to collectively move forward. So thank you for this opportunity.
100% agree with that. 100%. And you asked, like, how can we make things better? I think that's part of it. And Danelle just touched on it. I think as a society, we've been taught to avoid tough conversations instead of being able to have tough conversations but remain respectful. And maybe this is teaching people how to do that. So maybe that would be like our first step forward, because we can't not have the conversations, because then nothing changes.
Yeah, it's almost like people have become afraid of looking like an idiot. I mean, I will tell you, like, I was very afraid of looking like an idiot, because I have had to learn a lot of different things, and that's my choice to learn them, because they're not being presented as part of curriculum. And I don't want to look stupid, but I don't want to sit here and be quiet. And like I said, I don't want that for my kids. I have 2 little boys. I want them to watch this as soon as they're old enough to, like, they're 3 and 5. So, like, the earliest moment that they can watch this, they will.
Mm-hmm.
And everyone associated with my business as well. I mean, it's time. It's time to, like, not be afraid to look stupid and to start, like, asking the questions. And I really appreciate you letting me do that, because it takes, like, I think it just takes, like you said, like, the right discourse to, like, feel like you can.
Yeah, absolutely.
Yeah. I mean, if I could leave with anything being stated, I think, like, you're a mom. I'm a mom. And I think when you become a mom, a lot of the time you start looking at things through a mom lens first before anything else, because it's like, Mother Bear comes out, and then, like, everything else goes to hell in a handbasket. But if your child were Black, or if the shoe was on the other foot, if your child that you have loved, your child that you have raised, your child that you kiss goodnight, that you say prayers with, that hugs you, that tells you how much they love you, if your child could not walk the streets for fear that they were going to be killed, what would that do to you? If your child could not go into a work environment for fear that they were not going to progress, that there were going to be prejudices, that there were going to be all these negative things, what would that do to you? If your child could not, insert whatever situation here, because of their appearance, this is your sweet child. I love you, mommy, wants to hug you all the time. This is your baby. If that were the case, how would you feel? And I find that when I've asked several people that question, especially who have been moms and who have been white, it's like the light bulb went off in their heads, because that's something that's important to them.
Yeah.
And maybe that's where the gaslighting stops. Yeah.
Exactly. And to add to that, I think it's that lack of ability to put yourself in someone else's shoes, or that lack of empathy that we get. I don't know George Floyd from Adam. There's a good chance that, you could even say, because I wasn't born in the US, that I should have no understanding or affiliation with this man. But I purposely did not look at that video, because I knew what it would do to me.
Oh, yeah.
Right.
Because we have the same color skin, and that's all. And I knew that everything that had happened to him was based on just that. Nothing else, So even when I hear people talk about, well, you're good, and you're educated, and you're not like them, because there's this always this desire to separate, as Dwight said, you're the exception, and that's it's them. I'm like, no one's stopping to ask if I have an accent or a Trinidadian passport or American passport, or ask me if I'm a physician or a doctor or anything before they pull out their gun. They're just gonna look at this. That's it. So I have the split second, just like he does. And it shouldn't be that way, So it's that inability for us to see the empathetic side of like, how is your behavior affecting this other human? We have the same, and I said it to someone last week, I'm like, Black people we're not magical creatures, we're human. Like, we literally have the same emotions, the same fears, the same drives, the same goals, everything as everyone else. Whatever you have learned, or whatever your perception is factually inaccurate. We are human just like everyone else. So to not be able to see that empathy, you know, is very heartbreaking for me in a lot of ways. But it's something that I think, as Jay said, really will serve to unite us behind this understanding that we need to change.
Mm.
Any other closing thoughts? Anything that I missed? Anything else that you want other people to hear?
I can't wait for a year from now.
We're gonna have a date. Maybe we should
Hey,
have a glass of
Yeah.
wine with it.
that
And my obnoxiousness and my smartassiness level.
definitely some wine. Yeah.
I'll probably go with some kind of cocktail, but yeah, wine and
Absolutely.
cocktails. I like it. Rum and Coke, Jack and Ginger. I'm down.
Perfect. Well, thank you so much to all of you. I appreciate your time so much. And where can people follow and find all of you and connect with all of you? Jay?
Ladies
You can
first.
find me on my website, www.jmmhealthsolutions.com, on Instagram at The Pelvic Perspective, and then on Facebook and YouTube at jmmhealthsolutions.com, and my podcast, Fueling Her, A Woman's Guide to Wellness, on anywhere podcasts are heard.
Wonderful. And Dee?
So my website is 3ptdc.com. My company's Performance Plus Physical Therapy. Same handle on IG and Twitter, 3ptdc. Performance Plus Physical Therapy on Facebook. Podcast Dancing Around Elephants. It talks more about dancers and their injuries. So if you have any interest in that and figuring out just how dancers navigate the medical world and how it plays into how they aspire in their careers, take a listen. It's also on, I think it's on iTunes, Spotify, Lisbon, can't remember, just Google it, you'll find it, Dancing Around Elephants. And yeah, feel free to reach out. I'm happy to connect and chat and chat. I love to chat, so yeah.
All right. Well, I am, you can find me online at www.elitepainpro.com. IG is Dr. Barnes81, DR Doctor. And my podcast is kind of in limbo right now because I'm switching platforms. Or should I say, I'm switching the framework of it. So before it was, the title of it is Exceptional with the PT and a different color. Trying to be clever. But I'm switching from me just talking to the audience to a lot of this, actually. I'm going to be doing in-depth interviews, kind of long-form interviews with different clinicians and different people in healthcare. So that's going to take a little time because I got to get some behind-the-scenes things taken care of, but it will be coming back soon.
Fantastic. Well, thank you so much for your time.